Good afternoon, everyone. First of all, I would like to say thank you very much for taking some time off to follow us on Facebook Live to discuss this very important topic surviving prostate cancer. First of all, let me introduce myself. My name is Dr. Sritharan. I'm a consultant urologist currently practicing at Island Hospital in Penang. So, surviving prostate cancer. First of all, this is an important topic because it affects men. So, to get to the basic, let us see what is the prostate gland. Only men have this. Female do not have any prostate gland. The function of prostate gland is to produce seminal fluid that nourishes and transports sperm. So, in all men, this is the function of the prostate gland. And when we look at the prostate gland, we can see this is the bladder and this is the urine passageway which carries the urine out, and the prostate gland is just beneath the bladder. It encircles the urine passageway called the urethra. And prostate cancer is a cancer that occurs in the prostate gland. A question that is often asked, how can I survive prostate cancer? Well, in Malaysia, if we look at the statistic, 60% of the prostate cancer is diagnosed at an advanced stage. That means when the patient comes to see a doctor, the cancer has already spread to other parts of the body, meaning they have cancer stage 3 or stage 4, which makes curing it impossible. If we look at the prostate cancer itself, commonly prostate cancer is a very slow growing cancer. That means we have got ample time to make a diagnosis when the prostate cancer is at an early stage. And the only way to survive prostate cancer is we have to diagnose it early. You have to diagnose it early. And since prostate gland is only men have it, only men can do it. We have to step forward, take responsibility, and get it diagnosed early. And this responsibility also falls to the women who love their men. Maybe you can provide support and encourage the men to step forward and get this diagnosed early. What happens? What happens if a prostate cancer is diagnosed early? Well, 90% of men will survive for at least 10 years if treated early. And early detection means that we have to diagnose the cancer while it is confined in the prostate gland, and then we have the opportunity to cure it. Well, after all this, how do we detect prostate cancer early? Prostate cancer is special in a way because we can detect prostate cancer early by doing a simple blood test. We can measure the levels of PSA in your blood. A PSA level below 4 nanogram per mil is considered normal. Anything above that is considered an abnormal PSA. We can detect early prostate cancer by doing a digital rectal examination. And sometimes we can do a special scan called multiparametric MRI to help us in diagnosing early prostate cancer. And after all this, the diagnosis is determined by doing a prostate biopsy. And this can be done either through transrectally or transperineal. A lot of patients ask me, doctor, is a prostate biopsy really needed? If you have an abnormal PSA or an abnormal digital rectal examination, and or if a multiparametric MRI shows you to be at higher risk to have prostate cancer, the only way to determine, to confirm that you have prostate cancer is through a biopsy. Yes, you need a biopsy for confirmation. And the biopsy also provides additional information about the prostate cancer. Through the biopsy, the pathologist can have a look at the tissue sample under a microscope, and they can tell us how aggressive the prostate cancer, if you have, is by looking at a parameter called Gleason score. Generally, higher Gleason score means more aggressive cancer. And If you have more aggressive cancer, there is a real chance that the cancer will be a burden to you and it might even kill you in the near future. What do we do after a biopsy? If you have a biopsy and that shows that you have got prostate cancer, the next step is to do what we call a staging. Staging is basically few tests that need to be done to find out whether the cancer has spread outside or to other organs in the body. Generally, the staging are stage 1, 2, 3, or 4, depending on how wide the cancer has spread in your body. We would need to do special scans such as bone scan, MRI, CT scans, or even a PSMA PET scans to determine this. And why is staging important? Because by knowing the staging, your doctor can help plan the best treatment option for you. Prostate cancer treatment is based on risk and the stage of the disease. Generally, if the prostate cancer is confined in the prostate gland, that means you have got stage 1 or stage 2 disease, it is possible to cure this disease by doing surgery, radiation therapy, or in some instances you might need both. Sometimes in certain individual, we might opt for active surveillance or watchful waiting to determine when the patient will need this active treatment. Basically, in locally advanced disease, if the cancer has spread just outside your gland, but it doesn't spread to other parts of your body, commonly radiation treatment with anti-hormone is used. Surgery also have a role. And sometimes we might even use all modalities to treat the cancer in this stage. Whereas in metastatic prostate cancer, if the disease has spread to bone, lymph node, liver, or lungs, then the mainstay of treatment will be anti-hormone treatment, where we use certain medication or surgery to reduce male hormone level, testosterone. And when the male hormone level reduces, it causes shrinkage, and this will help to control the cancer. Often I see patients who, who might not know what questions to ask their doctors. Well, these are some suggestions for you if you're going to see your doctors about prostate cancer treatment. Ask them what are the treatment options, what are the advantages and disadvantages of each treatment option, and what can you do to reduce possible complication. This might help you in deciding what sort of treatment that is most suitable for you. If we look at the risk factors of developing prostate cancer, of course, age is one of it. Your risk of prostate cancer increases as you age. It is more common after age of 50. Race is also an important factor. In Malaysia, the prevalence of prostate cancer is highest in Chinese, followed by Malays and Indians. And family history is an important determinant. If you have first degree relative, your brother or your father who has got prostate cancer, then your risk might be increased, especially if they get the prostate cancer at an earlier age. Obesity is another risk factor. Patients who are obese have a higher risk of prostate cancer than compared to patients who have got an ideal body weight. So, by knowing all these risk factors, who should consult a doctor? By right, all men over the age of 50 should see your doctor to see whether you are at risk of prostate cancer. You have to remember that many patients with early prostate cancer do not have any symptoms. So you might be 50 years old and you might not have any urinary symptoms at all. But it is important you consult a doctor to see whether there is any risk of prostate cancer. Because remember, prostate cancer, if diagnosed early, at an earlier stage, Most often, when it's not causing any symptoms, then it can be cured. Men over age of 40 years with family history of prostate cancer or family history of breast cancer where there is some genetic abnormality are also at higher risk of developing prostate cancer, and they should start screening and consult a doctor from the age 40 onwards. And also a patient who may experience following symptoms is very important to see your doctor. Symptoms such as frequent urination, excessive urination at night or nocturia, patients who have or weak or intermittent urine flow, when there is a need to strain to pass urine, or when you notice there's some blood in your urine or semen, even though it's not painful. These are common symptoms in men as we age due to another condition called benign prostatic hyperplasia. But there is a lot of symptoms overlap, and you might want to consult a doctor early than just blame it on this benign prostatic hyperplasia. You might have prostate cancer. So it's very important to consult a doctor if you have any of these symptoms. Like I said, the most important step to take in diagnosing prostate cancer early is to consult your doctor. You need to take this step to save your life. Remember, early diagnosis saves life. So again, only men have got prostate. So please take charge of your own health and do step forward and consult a doctor if you are concerned or if you have any symptoms. Um, Thank you very much for following us on Facebook Live. Now we come to the question and answer segment. If there are any questions, you all can forward the questions to us that we can answer them. There are a few questions here, and one of the questions is, can you explain more on benign prostate hyperplasia? Well, like I said, all men have got prostate gland, and as we age, the prostate gland enlarges. This enlargement of the prostate gland as we grow older is a benign process, and the medical term for that is benign prostatic hyperplasia. As the prostate enlarges, and as you know, the prostate encircles the urine passageway. As the prostate enlarges, it can cause some obstruction and it can cause some irritation to the bladder. And basically, it can cause a group of symptoms such as hesitancy, poor stream, need to strain at passing urine. All right. These symptoms are quite common as you grow older, and these are due to benign prostatic hyperplasia. But you must remember, early prostate cancer, this also can cause these symptoms. So it is important to see a doctor to ascertain what is your diagnosis and what do you have. All right, there's one question here. Can I develop prostate cancer even after getting my risk factors under control? Yes, like I said, your risk factors that you can control are such as obesity. There are other risk factors that you cannot control, such as aging and family history. You can develop prostate cancer even though you are getting some of the risk factors that you can control. So it is important after the age of 50 for you to go and see your doctor and screen for prostate cancer. There's another question of what other diseases have symptoms that overlap with prostate cancer. So like I said, one of the important disease that can have overlap with prostate cancer is benign prostatic hyperplasia. Other conditions in the lower urinary tract that can mimic or have overlap of symptoms are such as urinary tract infection or overactive bladder syndrome, all right? Or another condition in the prostate called prostatitis. All these conditions, they have got symptoms which are quite similar, and it is important for us to do further investigation to determine what is your diagnosis. There's another question. Doctor, there are some times where I have to strain or push hard to urinate, but there are times where I have no problem. Could it be prostate cancer? Well, if you are over the age of 50 and you have problem passing urine, like I said, it might be early symptoms of prostate cancer, and it's important to consult a doctor and do certain investigation to determine whether you have it or not. The symptoms can wax and wane. That doesn't mean that you don't have a problem, all right? So when you have a problem, you have to investigate further to determine what it is. There's another question. If the treatment reduces testosterone, is it a good thing? Will my estrogen level go up instant? Like I said, if you are diagnosed with prostate cancer, which has spread outside your body, then the mainstay of treatment is androgen deprivation therapy, or treatment where we do surgery or give you medication to reduce your testosterone. When the testosterone level reduces in our blood, the prostate cancer cells shrink and the prostate cancer will be under control. This treatment does not increase your estrogen level, but when your estrogen level decreases, there might be certain changes in your body. You might notice your muscle mass decreasing. You might notice that you are getting more tired easily. There can be some effect on your libido, and there also can be some reduction in your hemoglobin level or your bone mass density. These are effects that can happen with reduced testosterone, and your doctor will know how to monitor and to give appropriate treatment if this happens. My child or teenager have difficulty urinating or complains about pain after urinating. Could this be related to a problem with prostate? Unlikely. A child or teenager who have got problem passing urine, unlikely the problem is with prostate. It might be due to other reasons such as infection, uh, but they should see a doctor to determine the exact diagnosis. Can prostate cancer recur after treatment? How should I be aware of cancer recurrence? Prostate cancer, if treated early, then the chances of cure is high. But then the doctor will always follow you up to see whether the prostate cancer recurs. After treatment, the doctor will most often measure your PSA level on a regular basis. Most of the time, if there is recurrence of this disease, the PSA level will go up. And once the PSA level goes up, then the doctor will have to do more investigation to see whether you have got recurrence and where is the recurrence, whether it's local or elsewhere in your body. There's a question here, if prostate cancer metastasizes, what are the common areas that will be affected? Prostate cancer normally it spreads to the lymph nodes or bone. It can also spread to other organs such as lung or liver, but it is less common. And prostate cancer also can invade locally to involve your bladder or the seminal vesicle or grows outside the prostate gland. Another question here, I was told that difficulty passing urine is normal as you grow older and it should not worry you too much. Your comments, doctor? Like I said, all of us men, as we grow older, our prostate gland do enlarge. Not all of us will have problem passing urine, but as we grow older, a great proportion of us will have problem passing urine. And it should not be attributed to growing old and to benign prostatic hyperplasia because, like I said, it also could be due to prostate cancer, which is a more serious disease. So you should see a doctor instead of making self-diagnosis to get the exact diagnosis. A question, can I still be intimate with my wife during watchful waiting after prostate cancer treatment? Yes, you can. There is no reason why you cannot be intimate with your wife during the period of watchful waiting or even after prostate cancer treatment. But unfortunately, there are some form of treatment which will affect your ability to have erection. So it might interfere with this intimacy, but there are ways where your doctor could give you treatment and to solve this problem. I'm 70 years old and in good health. Do I need prostate cancer screening? Like I said, nowadays people are living longer and healthily. And if you're 70 years old and in good health, there is no reason not to have your prostate cancer screening done. There is no exact cutoff point when you should stop doing your prostate cancer screening. It depends on your health, your comorbidities, and your expectation in life. I have TURP few years ago, and now I'm passing urine very well. Do I need to go for PSA screening? TURP is an endoscopic procedure normally which is done for those who have got benign prostatic hyperplasia who have got problem passing urine. When you have a TURP done, we are actually removing the central part, the central adenoma, the part which enlarges and causes obstruction to your urine flow. But there is still the peripheral part of your prostate gland which is left, and you can still develop prostate cancer even after this surgery. So yes, you need to go for PSA screening even though you have had TURP done. So last but not least, I would like to say thank you very much for all of you who have taken time to follow us on this Facebook Live. I hope my small presentation on surviving prostate cancer has given you some insight into this disease, and I hope it would make you do the decision to consult your doctor. And I hope this little information helps you in managing your prostatic problem. Thank you very much.